Good afternoon, everyone. This is Dhaval Patel. I'm founder with NiftyHMS. It's a healthcare solution. This is our team. I'm the CEO with the company. I studied in Ahmedabad. I'm Ahmedabad and also done masters from UK and 17 years of experience in IT and healthcare. And we have Dr. Neeraj Chauhan as our subject matter expert and Roberto Gregory from USA as our mentor on healthcare solution. So this is how a typical patient journey. So today's seminar is about digital transformation in clinics and hospital. Usually it's people do customer journey in different industries, but in hospital it's very rare where people do patient journey. And why patient journey is important, because through knowing the patient journey you can serve the patient better, and at the same time you can make it more profitable to run your clinic and hospital. So typical patient journey divided in 5 stages, where usually the patient's awareness, where they aware about your expertise or about your hospital name. Then there is a consideration where they compare your services and your offerings with other players in the same locality, and then come to the decision where they compare your services with other people, and then they have decided that they want to go with you or some other player. And then goes the treatment part, and then comes to loyalty. So in awareness, usually it's from the other doctor referring or other patient referring, or sometimes it happens organically where there is ads running on radio or TV or word of mouth, or nowadays online ads, right? So earlier the patient journey was very simple, where doctor would refer to a hospital, and a typical streamline where referring doctor sends the patient to your clinic, and then you do appointment, then you actually treat the patient, assess the patient, treatment and discharge, right? So that's more very simple way of treating a patient. In today's world, the patient journey is very different. Patient is actually influenced by a lot of different channels, not only social media channels but offline channels as well. So when they are actually considering their purchase decision, right, even if a doctor has referred to you that patient, they will still check on Facebook and Instagram what this hospital is having in terms of doctor's expertise or their ICU facilities, or what other patients are saying about them through online reviews and Google reviews. They also go and check on YouTube that what are you doing over YouTube. I mean, if they're having any videos where you are actually advising your patient to any preventive care or something. This is how they judge your expertise. And then only they are reached to a decision. And even after reaching a decision, they want to make sure that they are engaged sufficiently with the information on their health, and they need to be onboarded on every decision, whether you are actually trying to give them a surgery or recommend to other doctor, what's the reason of going into surgery, and if there is a delay in discharge, what are the points, that is what are the body vitals that is not actually up to the mark, and things like that. So they want to be informed every single point of time. And if a patient journey like this, if hospitals and doctors take care of it, patient feel empowered. Now let's consider the pain points for the patients. So in COVID, I think a lot of patients wanted consulting at comfort of home. Also, when there is scarcity of doctors in tier 2 and tier 3 cities of India, and it's also very expensive to do physical consulting for someone coming from remote areas, and there is less testing facilities as well in these remote areas. In terms of traveling, I mean, they have to sometimes, even as in India, we are having like 7 months summer kind of thing, where a hot environment, rainy seasons are big deterrent if they have to travel to see a doctor 200 kilometers away or something like that. And sometimes, waiting in queue for 1 hour is also a problem. It's a lot of expenses, like typical expense anywhere range from 1,500 to 10,000. If the out of city patient visits a doctor in the city. So digital transfer can solve these problems, and not only solve, but it can also increase the patient impact, right? So in terms of patient journey, we have seen that awareness and consideration is the stage where they actually initiate the journey. So as a doctor, you can make sure that you are available at all touch points. When I say touch points, means wherever a patient is searching for expert doctor in a particular segment or in a particular disease, you have to there. I mean, if they are searching on Google for gastroenterologist, or sometimes they search like पेट का doctor or पेट का surgery, best पेट का surgery कहाँ होगा, that kind of keywords they search, right? So you have to make sure that कहाँ जहाँ पे भी वो सर्च कर रहा है, जैसे गूगल पे सर्च कर लिया तो वहां पे भी आपका प्रेजेंस होना चाहिए. अगर lot of Gen Z is searching on social media, so you have to make sure that you have ample social media channels and you have good content over there as well. Now Google business listing is also one of the because whenever someone's searching, like for even if for your hospital's name, for example Kaizen Hospital, then the Kaizen Hospital website will come later on, but first Google listing will come. So you have to make sure your Google business listing is also up to the mark, and you can also put up your number where appointment can be taken. So the Google business listing has to have all, not only phone number and location, but your photographs, then your case studies, success stories, rating and reviews, everything should be there. And once the patient has been engaged with you, means they have decided to go with you at the surgery, you also need to make sure that their data is stored securely with you, and their appointments and their prescription and assessment, patients should have access to those data as well, right? Maybe through WhatsApp, maybe through access to uh, uh, online web portal, but this has to be done. And once the treatment has happened, right, then after the post consultation period starts in, where as a doctor, I mean, I would suggest, I mean, anyone thinks that I have treated a patient, he's happy, now he's discharged, my job is done. Don't think like that. I mean, post consultation process is also very important, because you want to keep this patient referring to you to other patients, right? So engage them even after your discharge has happened, even after you have successfully completed the surgery. Also, you can build a loyalty card or free health tip that you can automate it. This is some ways where you can engage the patient even after the surgery or their engagement is completed. So in terms of corporate website, you should have, there are a number of ways, you can create a website, but in nutshell, you must have a dynamic website where you have a blog, where you can actually upload some content, interesting case studies or success stories of patient. Then you also need to make sure, I mean, whenever you go to a website, I mean, usually the patient's viewpoint is like, whenever they go to a website, they want to see who is the doctor, right? There is a personal connect. Then what are the facilities? Like if you have ICU, if you have pharmacy inside, you have laboratory, make sure you highlight them in first page itself. So they don't have to scroll down on the website. They just have to see something in banner. Once they are engaged with banner, then they will see a lot of other informations in your website. Same thing, I mean, a lot of patients will look for the appointment booking link, right? That's how the whole journey starts. So make sure that you have appointment booking link on the website. Also social media, like you have social media presence, but you are not putting up on website, or sometimes you have a website but you are not putting up in social media, so you have to cross reference. So put a social media link, redirect it to a social media channels, and then put up a gallery where all the photographs and all vibrancy of your operation is evident. And blog and knowledge base could be useful for the patients to get the health tips. So Google Business Listing we roughly touched upon, but I'll just go through that once again. So whenever someone's searching on Google, business listing comes first, then the website or the third-party services. So make sure that is very well populated, and you put up a location, operating hours, clinic photos. The best part with Google Business Listing is you also get a lot of data. I mean, who visited your Google Business Listing profile, what time, what was the age, whether it was a male, whether it was a female. So this way you can understand that people from these certain cities or certain areas are searching for you. Maybe it's a time for you to open a clinic over there. Also, rating and reviews are there. So if any negative review is coming up, make sure you handle it properly. Sometimes people are frustrated if the operation is not successful, maybe not your fault, but it's hard to convince someone, right? So they would leave a negative review. You have to write a lengthy response to it, explaining why this was the case and why this patient was not happy. So that way, other people who are reading the review, they can actually understand your point of view as well, right? Okay, so let's move to social media and WhatsApp marketing. So there are different type of patients. So millennials is born before after 1980, and Gen Z is born after 2020. Behavior of this patient is different. Millennials are more prone to go on to Facebook, whereas Gen Z is more prone to go on Instagram, right? But you want to make sure you want to cater to all generations, like baby boomers. So we actually divide the whole patient in 3 or 4 segments: that baby boomer, millennials, and Gen Z. So the baby boomers will are active on WhatsApp, so you have to reach out to them on WhatsApp if you want to make yourself in front of the patients. So you have to create a social media channel for Facebook, Instagram, LinkedIn, and YouTube. You have to post interesting content every daily or maybe weekly basis. Video content is very popular nowadays, so Instagram stories in terms of videos, and also YouTube videos you can go. Sometimes this video content might be just customer patients testing. Sometimes it will be your expert advice. Sometimes it will be your real time case study where what was the challenge and how you come over it. So you can cater to different segments. Sometimes you cater this video to different doctors, right? And sometimes the video might be relevant to patients. You should manage likes and comments and make sure that you are responding to any comments that's happening on social media. Keep the branding same, like whatever logo and color you are having, blue or white tone. Make sure the all social media channel has the same thing. So these are silent psychology that works out. And then there is reports and metrics to understand the user engagement on social media. How many likes, how many follows. Those are the important parameters. How we can increase patient engagement? After once you have done the considered awareness, and when you are engagement stage, you want to make sure that patients are engaged all the time. So to keep the patient engaged, you need to log all the patient's problem, log all their health records digitally, right? Once you have the data, then only you can effectively engage with the patients. So you can also share treatment with patients in real time through HMIS, right? This is also important because they need to feel empowered. They need to feel that they are always acknowledged for whatever decision has been taken, right? And you need to have details on either male, female, what are their likes and dislikes, their birthdays and anniversaries, what are the location, the income bracket. Their medical history is very important because this is how you actually write some content and put it to the WhatsApp channel or social media channel. So put up appointment reminders, health data on WhatsApp, give email health tips on email, health tips on social media, conduct webinars. These are all different ways you can engage with patient, right? And you can also have live question and answer sessions. Like this, what we are doing, this kind of way to reach out to patients is very effective. You can also run survey on patient experience once they have been treated at your clinic or hospital. And you can also collect data on health issues they are facing. Another way of increasing patient engagement is to do a health awareness camp. You can tie up with corporates or other labs and collect health data like their blood pressure, their oxygen level, their diabetes, and so on. This way you are reaching out to the patient before the patient reaches out to you. This is very effective way of reaching out to a patient and then actually getting them to know about your expertise and your services. So whenever they want to consider something for surgery or some other needs, they would have your hospital first come up in their mind. So which is very important. And you can also tap into CSR activity with corporate to run these camps, or go tap with government and semi-government to execute or facilitate this kind of camps. So this is the offline mode of engaging with patient. We earlier covered the online mode of engagement with patient. Okay, so now comes the patient trust. So you don't need only one-time patient. You need patient keep coming. So whatever health issue they have, if you are having a multi-specialty hospital, right, you want to make sure that for other diseases or other health needs, they can also come to you. So the best way to build the trust and loyalty is to save lives or successful treatments. Once you have done that, they will automatically refer your services to other doctors or other patients, within their community or within the apartment kind of thing. Also, the whole treatment experience. I mean, you have successfully treated. I've seen a lot of doctors in hospital. They are good at treating patients, but whole experience, right from reception to food, then discharge, ambulance, everything. So all this is customer journey. Make sure at each point there is no friction. Their experience is very pleasant one. This way, not only you have treated a patient successfully, but you have brought the happiness, and happiness leads to trust, and trust will lead to reference. It's a simple theory. You can also create a loyalty program where you can distribute loyalty card so that they can get some preferred rates on medicine or treatments and lab reports. And the loyalty card is also something that gives you opportunity to reach out to them regularly because you have their personal details, email and mobile number, and reach out to the patient, give them the free advice, health tips in terms of preventive care. So patient has a positive impact that if you are talking about preventive care, then you are asking them to not fall sick kind of thing. So the trust level goes up. And when there is a disease that is beyond your expertise area, you connect personally to other doctors, make a positive reference. This is also goes long way. So what are the benefits for doctors to get digitized and to transform their clinic digitally? So you can also have flexibility to. I mean, if you are adopting any remote consulting software or HMIS, where you can access the software or the system from anywhere, anytime, even if you are on holiday. And you can actually treat the patient remotely. Can do more with less. I mean, if the data is streamlined and all the data is collected well in advance, right? Like pre-screening form, you can do more with less. So staff crunch is very heavy right now. So you can do less with physical setup, legal estate, and all those things. At the same time, if you are having the website, social media channels, HMIS, everything as per your vision and mission statement, then you can also increase the revenue because now a patient far away from UK, US can also reach out to you and get treated. Second opinion is a big thing nowadays. So people from other countries also get a second opinion with you. This all requires a digitization. So digitization is stepping stone for you to get the patients even outside of the country. So that was, and then this is the value creation that you can expect from. This is a typical value creation after digitization. So 5x can revenue can increase. You can also reduce staff 2 times. Waiting time can be reduced if you are adopting a digital solution, and patient can be increased because now you are able to see patient outside of your city or country. So those are the advantages. Right now we are open for any question and answer. I hope this was informative session for everyone. I guess I have explained very well. Then there is no question. Brownie points for me. I guess then we can wrap it up. I think it's been a great audience, very quiet one. I hope you have got the point. What are the benefits of digitizing your clinic and hospital, and the digital transformation is the need of our. And if you need any help in digitizing your clinic and hospital, do let us know. We'll be happy to reach out to you in that terms, and we have years of experience uh, helping doctors and clinic get digitized. With that note, I think we can wrap it up. Okay. Thanks, everyone. Thank you for listening to me. Thanks for your time. Have a good day. Bye.